Hello everyone, I am Mrs. Tahreen Taj, Assistant Professor, Department of Pharmacology from Yenepoya Pharmacy College and Research Center. I welcome you all to today's lecture on the topic Anti-hyperlipidemic drugs. These are my contents which I am going to cover in today's session, that is specific learning objectives, definition and types, causes, anti-hyperlipidemic drugs, mechanism of action, pharmacokinetics, uses and adverse effects, and summary. So at the end of the session, you should be able to define and segregate the types of hyperlipidemia and lipoproteins, define and classify anti-hyperlipidemic drugs, explain mechanism of action of HMG-CoA reductase inhibitors, describe adverse effects and uses of HMG-CoA reductase inhibitors. Before moving on to the anti-hyperlipidemic drugs, let's understand what is hyperlipidemia. So, it is an abnormally elevated levels of fat particles in the blood, which is known as lipids. So, these lipids can adhere or stick to the walls of the arteries and restrict the flow of blood, which in turn it will create a significant risk of heart attack and stroke. So, there are different types of lipids. So, those are cholesterol, triglycerides and phospholipids. So, if we see cholesterol, which is helpful in synthesis of bile acid, and it is also maintains the integrity of cell membrane. Next, triglycerides, which consist of glycerol and fatty acids. This will serve as an important source of energy that can be stored throughout the body. Moving on to the phospholipid, which is a major component of all cell membranes and it functions as a emulsifier. First, let us see what is lipoproteins. So, lipids which are insoluble in blood plasma, they have to be transported throughout the body in a protein capsule which is called as lipoprotein. So, this lipoprotein, it consists of hydrophobic core. This hydrophobic core consists of cholesterol and triglycerides. Below the hydrophobic core, we can see hydrophilic shell, and this hydrophilic shell, it is made up of phospholipids and apolipoproteins. Till now, you have understood about cholesterol, triglycerides and phospholipids. Now, let's see what is apolipoproteins. So, apolipoproteins, these are specialized proteins which control enzymes in lipoprotein metabolism, and also it will serve as a ligands for lipoprotein receptors. There are different types of lipoproteins. So, this depending on the variation in lipid and apolipoprotein composition as well as their density. So, there are different types of lipoprotein such as chylomicron, VLDL, which is also called as very low density lipoprotein, LDL, which is called as low density lipoprotein, and HDL, high density lipoprotein. So, these are the four different types of lipoproteins. So, let's see one by one the types of lipoprotein. Chylomicron, which is produced in the gut from dietary lipids, it is also composed of triglycerides as well as cholesterol. Next, VLDL, very low density lipoprotein, which is produced in the liver and it is composed of triglycerides and some cholesterol relatively larger in comparison to the chylomicron. Next is LDL, low density lipoprotein. So, as this triglyceride decreases, VLDL will turn into the LDL, which has a higher amount of cholesterol which will be delivered to the cells for cell membrane and synthesis of steroid hormones. Whereas HDL, this will produced in the liver and small intestine, and this HDL is composed of proteins with a smaller amount of lipids. Now, this LDL and HDL, it is also called as, LDL is also called as bad cholesterol, whereas HDL is called as good cholesterol. So, why it is called as bad cholesterol and good cholesterol? So, here you can see low density lipoprotein, which is also called as bad cholesterol. High levels of LDL cholesterol, this can build up in the inner layer of artery walls, which leads to the formation of atherosclerotic lesions. Whereas high density lipoproteins, which is also called as good cholesterol. So this HDL, this will help prevent the atherosclerotic lesions by removing the cholesterol, and also it will reduce the LDL oxidation and inflammation of the blood vessels. Also, the low level of HDL can also contribute to the atherosclerosis. So, we need to maintain the high level of HDL so that it will prevent the atherosclerotic lesions. What are the causes of hyperlipidemia? So, let us see the different factors which are involved or which will attribute the hyperlipidemia. So, hyperlipidemia, this may be caused by individual lifestyles, that is lack of exercise and high consumption of the fatty acids, and single inherited gene defect in lipoprotein metabolism, and also more common combination of genetics and lifestyle factors. So, these are the different factors which will lead to the hyperlipidemia. Now, let us move on to the anti-hyperlipidemic drugs. So, we have understood here about hyperlipidemia, how hyperlipidemia will be caused and what are the different types of hyperlipidemia, different types of lipoproteins. Now, we will see how we can reduce this hyperlipidemia. So, this anti-hyperlipidemic drugs, which are also called as hypolipidemic drugs. So, this hypolipidemic drugs is also called as anti-hyperlipidemic drugs, and these drugs are the class of drug which can help lower cholesterol and potentially prevent cardiovascular diseases. So, classification of hypolipidemic drug or anti-hyperlipidemic drug. So, these are classified into 5 different types, that is HMG-CoA reductase inhibitors, which is also called as statins, and in this session I am going to discuss about that. Next is bile acid sequestrants, next lipoprotein lipase activators, lipolysis and triglyceride synthesis inhibitor. Now, last one is sterol absorption inhibitor. So, you can see there are different examples for each and every types. Okay. So, statins, lovastatin, simvastatin, pravastatin, etc. and bile acid sequestrants, that is cholestyramine, cholestyramine, and lipoprotein lipase activator, you can see gemfibrozil, bezafibrate, fenofibrate, and next one lipolysis and triglyceride synthesis inhibitor. You can see the example nicotinic acid, and last one is sterol absorption inhibitor, where you can see the example ezetimibe. So, these are the different classification of hypolipidemic drug. Let us discuss about HMG-CoA reductase inhibitors, which is also called as statins. So, this HMG-CoA, the full form of this HMG-CoA is 3-hydroxy 3-methyl glutaryl coenzyme A. So, it is an structural analog of 3-HMG, and the first statin which is approved for human use is lovastatin, and this lovastatin is isolated from the fungus called Aspergillus terris. So, it is a most effective and well tolerated drug. Moving on to the mechanism of action of HMG-CoA reductase inhibitor. So, this statins, they will competitively inhibit conversion of HMG-CoA to mevalonate by the enzyme, that is HMG-CoA reductase. So, this leads to decrease in cholesterol, and the body makes more LDL receptor to grab and remove LDL from the blood. So, this VLDL production will also be reduced, which helps lower the triglyceride levels, and even the statins may also increase HDL levels. So, what are the pharmacokinetics of this statins? So, the statins drugs, this will well absorbed orally. As it is orally absorbed, and as statins are taken through oral administration, this will get affected by first pass metabolism. Due to that, bioavailability will decrease around 10 to 30%, whereas distribution, it is highly protein bound and it will get accumulated in the liver, and even metabolism can takes place in the liver with the help of enzymes, that is CYP450. Whereas excretion of the statins will takes place in a bile and feces. Even we can see the small amount of excretion can happen through the urine. So what are the uses of the statins? So this will lower the cholesterol, even it will prevent the cardiovascular diseases such as stroke, and even it will manage the atherosclerosis. If you see the adverse effect of the statins, it will leads to muscle related issues like myopathy, myalgia, whereas even we can see the adverse effects like liver effects, that is hepatitis. After that, gastrointestinal issues also can be seen, such as nausea, diarrhea, constipation. After that, metabolism effects also can be seen, that is increase in the blood sugar level, hyperglycemia, and next some of the neurological effects also can be seen as a adverse effect. Neurological effects is nothing but it may be a confusion, delirium, all these things. So summary, hyperlipidemia is the elevation of blood lipids, raising the risk of heart attacks and strokes. Lipoproteins transport lipids in the blood. LDL contributes to artery blockage, which is also called as bad cholesterol, while HDL helps clear it, which is also called as good cholesterol. Anti-hyperlipidemic drugs, also called hypolipidemic drugs, these are used to lower cholesterol and prevent cardiovascular diseases. Statins, these are primary class inhibiting the HMG-CoA reductase enzyme to reduce cholesterol synthesis and increase LDL clearance. So these are my references. Thank you.